When a heart attack or a stroke happens, we know time is of the essence. And at Licking Memorial Health Systems, their teams specialize in providing timely, life-saving techniques and technology for their patients.
And there's no bigger part of that team than Dr. Rajub. When it comes to heart care, heart attacks, he's the one that jumps in and really saves lives throughout our entire community.
Yeah, he is the man, as we will call it, in heart care at LMHS. So, Dr. Rajub, I want to start by just giving an overview of the services that you offer, because heart care, I mean, that includes a lot underneath it, right?
Right. There's a lot of diagnostic tools to find out, even try to prevent a heart attack before it happens, educate patients. So we do all like 2D echoes, 3D echoes, transesophageal echocardiograms, tilt tables, even calcium score that would tell us if you're at risk for heart trouble in the future. Non-invasive ways of looking at the coronary arteries with the CAT scans. Now we do it in there, in certain patients, obviously. All these tilt table tests, and event monitoring, all these are done.
And I was just going to ask, because I feel like people are more aware of their heart health in so many ways. Are they coming in more often? Are they paying attention to those things when we talk about our heart health? Are you seeing that?
To a certain degree, you still needs more education. Always you have to remind people what's the right food. It's always easy to go for the fast food and the easy food, and that's the biggest thing for us, biggest challenge. Smoking still actually prevalent more than we like. These are the main things we try to educate people. These are the things you can change. Genetic stuff you cannot change, obviously, which plays a big role in the heart, but really these are the things we like people to improve their lifestyle, exercise more, do all this stuff. And Licking Memorial do some events here and there to educate the public.
And I've been around Dr. Rajub enough to know, cut down on the soda pop. You are not a fan of that, so drink more water.
You walk down the hallways and just knock it out of your hand? Is that what he does?
Definitely drink plenty of water. That's
water
always,
is good.
That's
water
always
is
the
good.
message he gives all of our patients. So time is muscle when it comes to taking care of a heart attack. And so I know you and your team do an outstanding job. So talk about some of the assurances you would give our community about how quickly you're able to address heart issues.
That's a big statement by Dr. Braunwald 40 years ago, time is muscle, because the heart is a big muscle. So every minute counts. When you have something called a STEMI, which stands really for a heart attack happening right now, this is probably the biggest emergency you could have in your lifetime. Basically, that's a combination of symptoms of chest pain, shortness of breath, sweating, and when we get an EKG that shows ST elevation and some leads that's consistent with the STEMI. So this is usually the first thing that paramedics will do when they come to your residence, wherever you are. If you call 911, they come in, they do an EKG. They're equipped with machines that would transmit the EKG right away to the hospital, alerts the ER physicians, and if they agree with the diagnosis, we send a STEMI alert, and that alerts the STEMI team, which is a big team actually. Labs, radiology techs, nurses, interventional cardiology. So when everybody lives within 30 minutes. So this is 24 hours. Any time of the day, blizzard, no blizzard, we're there. Somebody has to be there within 30 minutes. And the goal is to get the patient who's having the heart attack from the ER to the cath lab and open the artery within 90 minutes from the first time they called the 911.
That's incredible. And I imagine just the odds of, surviving, of recovering are immensely better when you have that amount of information, that amount of time, really.
Oh, definitely. We used to be before wait till the patient arrives, get the EKG, somebody reads the EKG, activate every minute counts. As we said, time is muscle. So if we can open the artery within 30 minutes, great. 60 minutes, still very good. 90, that's the national goal line. It's going to do two things: save the patient's life, and then even if they survive, we want them to have good quality of life.
Yeah, exactly.
And if you do it faster, you have almost recovered completely. We have a lot of patients with no damage to the heart muscle after a heart attack, which is amazing. I've been doing this for 20 years, but now it's like, you can't tell if somebody had a heart attack sometimes.
He's being very humble. They often are able to be well below 60 minutes, and sometimes they're literally waiting for the patient to arrive on the ambulance and are able to really get going right away.
You've been around enough doctors, right? They are humble because they save lives every day.
Yes,
And we
yes.
love to see it. We love to learn more about it. And go to the website too anytime. You can learn more about all the services because you guys really are kind of on the cutting edge with a lot of the technology and the techniques you use. So thank you so much for being here.
Thank you.